Okay, so like I explained, this occurs when the acute response cannot be resolved, either because the injurious agent is persistent or there is interference in the normal process of healing. So what will happen is that the inflammatory process would be ongoing. So these are some examples of settings or situations where you have the inflammatory process becoming chronic. So an example is a viral infection. So in viral infections, especially where the virus enters the cell, it becomes intracellular. Okay, or you can have persistent microbial infections like mycobacterium, tuberculosis, for example, or fungal, or treponema pallidum, that's a syphilis. Then, in situations where there's prolonged exposure to the microbial agents, for example, if you inhale silicone or asbestos, or in situations where there's an autoimmune disease, so that the individual is trying to clear self-antigens. Because the antigens are part of the individual, you'll not be able to clear them. Okay, so you also have what we call chronic granulomatous inflammation. This is a pattern of chronic inflammation whereby macrophages aggregate and you have giant inflammatory cells coming together. Yes. Another example is when you have foreign bodies. So sutures, splinter, breast implants, these ones can also lead to a chronic granulomatous inflammation. So more examples: leprosy, parasitic infections, fungal infections. Okay, so morphologically, if you stay in a preparation with H&E, you'd realize that the macrophages are pink and then the cytoplasm is indistinct. Then you also realize that because of the chronic inflammation, there's a rim of fibroblasts or cells which form fibroblasts around the inflammation. It's like the body is trying to seal off the inflammation. So you have a giant inflammatory complex, and then you have cells surrounding it to try and seal the inflammatory reaction so that it doesn't spread to other parts of the body. Okay. So these giant cells can be about 40 to 50 micrometers in diameter. And you realize that the center of it, you have an area of necrosis, and then you have the inflammatory cells around it, surrounded by a rim of fibroblasts. And this is very typical for tuberculosis, what we call the caseous necrosis. Okay. Please, are there any questions?
Yes, madam.
Yes.
Madam, I want to ask, with issues of birth control method, where there is something implanted into the ladies. Now, won't the body see it as a foreign body? The system see it as a foreign body and react to it.
Issues of what? I didn't get the first part of your
Birth control. Birth control.
birth control.
Family planning. Family planning.
The implant, like the implant that is inserted in the arm.
Yes, madam.
Yes. So what will happen is that there will be an inflammatory reaction around it. So yes, it induces an inflammatory reaction. So you realize that when you touch that area, it's very hard. And that is what I was saying, that it gives that kind of chronic inflammation and eventually the body will try and wall off the inflammation. So you'd realize that the inflammation will be ongoing, and then there'll be a rim of fibroblasts formed around that particular size of chronic inflammation. So that is what you palpate under, and you realize that the area is all very hard. So yes, because it's a foreign body to cause inflammation. Are you clear? Any other questions?
Please, I want to ask this question.
Mm-hmm.
Yes, please. Before inflammation become chronic, does it go through a process from the acute? Does it go through process before it get to a chronic stage?
No, it just persists. So acute inflammation and chronic inflammation is the same process. But when it goes on for more than a few days, then it's called chronic.
Okay.
That's the duration.
Okay. Thank you very much.
Hello, madam.
Yes.
Please, I want to know, with drugs like paracetamol and ibuprofen, both of them help in the management of fever. Sometimes ibuprofen works better in the management of fever than paracetamol. I want to know, has it got something to do with the binding of prostaglandin or something else?
So no, they don't bind prostaglandin. They inhibit it. They inhibit the production of prostaglandins. That is how
Yes.
they inhibit their production. And you realize that the prostaglandins are involved in the production of fever and also for pain. They mediate fever and pain in the inflammatory process. So the extent of analgesic or antipyretic activity depends on how effectively they are able to inhibit the production of prostaglandin. Okay. And this also depends on the enzymes which are inhibited in the production of prostaglandins. So when we say that the drug is inhibiting the production of prostaglandins, what we mean is that it is inhibiting the enzymes in the pathway of production of prostaglandins. You get me? Brufen and the other NSAIDs, they are more potent inhibitors compared to paracetamol. Okay, so that is why Brufen is a stronger painkiller and it's a stronger antipyretic than paracetamol, because Brufen is a more potent inhibitor of the cyclooxygenase pathway, which produces prostaglandins compared to paracetamol. Your question answered.
Yes, mom. Thank you.
You're welcome.
Madam, please, I have a question.
All right.
Please, looking at this whole inflammation thing, I think it's quite good because the body is trying to get rid of an infection or something. So why is it that when you have an inflammation, you try to stop it by taking these drugs? Because from my understanding, the inflammation is going a long way to reduce
Yes.
an infection. So why do we try to stop it?
So the inflammation is good, but it causes pain and it causes fever. You see? So it's the pain and the fever that we are trying to get rid of by taking the analgesic or the antipyretic. So it is
a quick follow-up question. So if we get rid of the pain and then the fever, does it stop the process of the inflammation from going on, in the sense that it will not make sure that the inflammation process ends with the elimination of the microorganism?
Yes. Take antibiotics. Okay. If you know what is causing the inflammation, so let me give an example. For example, you have cellulitis, okay, or septic arthritis. So the knee joint is swollen, it is red, it is painful, you can't walk on it. And then you realize that when you touch it, it's very warm. So that tells you that there's an inflammatory reaction going on.
Okay.
And you know that definitely it is due to bacteria. So what you do is that you give antibiotics to eliminate the bacteria, and then you give pain relief, which
Okay.
will also bring down the fever. Okay.
Yeah.
It is a natural process. In fact, if you allow it to go on and you have a good immune system, you should be okay. But then the downside of it is that you are going to suffer a lot of pain, and you have very high temperatures for a while before it settles. So if you have an infection and you don't do anything about it, if you have a very good immune system, it will sort you out and you will recover in a few days. So let me give an example of the common cold. Okay, common cold is a very, it's not life-threatening. It's a mild infection. So you get some fever, you feel ill a bit, you have a headache, there'll be pain and all that. If you don't take any medication, within 3 days, you are fine. But you want to go through 3 days of pain and torture and all that. Some people would not take anything and they'll drink a lot of fluids, they'll rest, and they'll be fine. Others too, maybe because of the nature of their job, they can't afford to lie down or lie around. So you take the painkillers and also take vitamin C, other things because it's viral. And then eventually you'll be better. So if you want to terminate the inflammatory process, then you need to take antibiotics. Are you clear?
Yes,
So,
madam.
madam, to my understanding, meaning the drug that you are taking is not stopping the process, or
Stop the process.
If it is an antibiotic, it's stopping the process. But if it is just paracetamol, it's not stopping the process. So in pediatrics, for example, I tell my patients, I tell the mothers that if your child has a high temperature and you give paracetamol, don't just sit at home. Okay? The paracetamol is to stop the fever and the pain. But if there's an underlying cause of the fever, you haven't tackled it. So you need to get to hospital, do investigations to find out what is causing the fever. Sometimes we say that the fever is good, the pain is good because it tells you there's something wrong. So once you deal with whatever it is, the pain will go and the fever will also go. Okay. But it's just that because it's uncomfortable, you'd want to treat those, but that's actually not the solution.
Okay.
I hope you are clear.
Yes, madam.
yes. Madam,
Yeah, yes.
madam.
Yes.
So, like, we haven't received some of the slides, or previous lectures and all that. We haven't received the slides.
For pathology.
Yes, please. And I
Okay.
think clinical method to the first lecture, we did not receive the slide.
Which
That
one?
one is not our first lecture, the one we met in class.
What was the topic of that one?
Next topic here then.
We have all the slides.
I feel now this next topic near there.
No, I went through all the slides. It wasn't part. Madam, you taught us about
Which
that one.
which one was in part?
The one,
was in part?
the female.
Yeah, she was giving us all the slides.
The
Keep quiet
endocrine.
there. Yes, madam. Yes, madam.
The endocrine.
The one we're talking about amenorrhea and impotence
Yes,
and all that.
yes.
Okay. I'll send it.
Okay.
So the one class,
No, I know you're
You forgot because he wasn't in class. I remember, Pa.
madam.
What's up?
Hello,
Just like
madam.
bread. Just like bread.
Sada na emenda na sinekusi.
That was the day of Evans's wedding.
Ladies and gentlemen.
Any other question?
Madam, please, my network.
Stop saying network. Network when it disturbable.
Oh, Nyabotre, madam, answer me. Oh,
Yeah, two question, no.
What's your question?
my network, actually, lectures, and the no matter.
They see him fast.
When you need a koshipo, why? Koshipo.
Oh, it's enough. It's enough. Let him ask his question, please.
From where? From which part?
Madam, when you after you answered my question, my network went off, so the rest.
One can be near per slide.
What answer you network at I hope it didn't be. After she answered your question, the network went. After she answered your question,
Madam,
the
don't
network
mind
went.
them. Go, madam. You don't mind them. Don't mind them. Go and sleep.
That question.
Madam, you are tired. Go and sleep. Don't mind them.
So, madam, please, the slides, if you have it.
Oh, madam, forget them. Go and sleep. Madam, you know you are tired. Go and sleep.
Nathaniel.
Are we okay?
Yes, madam.
Everyone okay?
So, more person, more chairman say, you see, madam, because more explaining your watch, you move it to me.
Right. Madam, submission. One submission. I think the lecture went well. It went well, but there are some certain parts we couldn't get them right. But I don't know if we read this, we go over the slides. Maybe if we can get them or not. But if
I'll send you the slides this evening. You can go over. If we have not willing tomorrow, if you have questions, we clear your questions and then we move on.
Madam,
okay, madam. Thank you.
Please let me ask a question.
Adjudicator,
Yes, look.
Yes,
Yes,
okay.
yes. Madam, please, I want to know if
Madam, can I ask my question?
Deficiency. Oh, Evans.
There's a question on defects in inside function.
Massa Christian.
Does it lead to chronic inflammation? That's the question.
No, madam, please. My question is deficiency in peroxide. Can it lead
the peroxide
to candida infection?
Can it lead to what?
Ladies who have candida infection. Ladies who have repetitive candida infections.
Can it be that what?
Deficiency in peroxide. MPO. Deficiency in MPO.
Myeloperoxidase.
The creditor, son.
Okay, madam. Esther's hand is up.
Yeah, please ask your.
Mama Esther, please ask your question.
Christian is out of credit, please.
Madam, please, my question is, it has to do with
Yes, boss is boss.
It has to do with what?
wounds. With some diabetic wounds, when you nurse it, it takes time, but it heals. Hello, madam, did you hear me?
So with some diabetic wounds, they heal.
Yes, but with some, it takes a longer time. It doesn't heal at all.
Is that a question?
Yes.
So what's the question?
So the question is, what is causing it? Is it because of? Is it due to that they all have different inflammatory pathways, or there's something wrong with the other patient? That's what I want to know.
If you remember what we talked about for the inflammatory process, we said that there are defects in the inflammation. So if you look at diabetes, for example, for diabetes, there are problems with their chemotaxis, their adhesions, the phagocytosis. So this would cause problems with the inflammation, and that would lead to poor wound healing, because it's the inflammatory process that would lead to healing. Our next topic will be wound healing. So you'd realize that if inflammation doesn't occur, wound healing will not occur. So if the diabetes is poorly controlled, then it means that there will be defective inflammation, and that's what will lead to. So it has to do with the diabetes control. So the difference between the two diabetics, one with a that heals quickly and one which doesn't, is their diabetes control. If the diabetes is well controlled, you realize that the wound heals well. If it is poorly controlled and their sugars are all over the place, then those people would have wounds which would persist for a long time.
Okay.
Are you clear?
Yes, madam. Thank you.
Okay. Daniel, specialist, you had a question. Daniel.
Yeah, the next question.
Daniel, specialist. Okay, if he's not around, Solomon Ade, you had a question.
I was asking whether the defect in leukocyte deficiency leads to chronic inflammation.
Yes, please.
Okay.
Okay, so when you have a defect in the leukocyte adhesion, it means the inflammation process will not.
Yes. I wanted to ask whether. Madam, is it possible for Madam to access?
On the same answer,
The question is for what?
Another question.
We beside exams question.
What type here?
Madam, so Christian sent a text to the chat. I think because we can't hear him, he has sent it via text.
Okay, yeah. Let me look at it.
Hello, madam.
Okay, he says, Madam, can deficiency in MPO lead to recurring candida infection in women? That was his question.
Yes, but it can, but that is not the only thing that can cause candida infection. So, and it will be difficult to prove that that is what is causing it. So you have to investigate for the common things like diabetes, like other causes of immunodeficiency, because it will be difficult for you to conclude that it's myeloperoxidase. I hope you understand.
Okay. Daniel, are you okay? Is your microphone okay to ask questions now?
My microphone is okay, but my network is disturbing me. I wanted to ask whether Madam would, is it likely she would ask us to explain the acute inflammation? That's
if you now explaining an answer, what do you mean?
That will be an examination question.
Exam,
you can be feeling it.
Because pathology is a lot, I'll ask you multiple choice questions.
Okay, you are very good.
Yeah, that's sure.
Madam, you too.
Operator, your hand is up. You have the question.
Hello, madam. That's
you too.
Hello, Nick.
Yes, Solomon. Hold on. Solomon.
I think my question was not answered.
What's
ask
your
the question again.
Yeah, it's about the neutrophil defect.
I answered it. What I said was that, you see, when you have the inflammatory process ongoing, if there's a problem with the leukocyte admission, the inflammatory process would be terminated. It will not occur.
Okay. Thank you.
So it doesn't lead to chronic inflammation.
Okay.
Elisha, your hand is up.
Yes, madam. Still on pain and fever. The actions of prostaglandins leading to this. Now, let's assume I take a drug like amoxicillin and I have a side effect of headache. I want to know, is my system seeing it as a foreign body and producing that against it or what?
The side effects of medications are not inflammatory reaction. What happens is that the medications act through different pathways. That's what causes the side effect. It is not an inflammatory reaction. So that's
Please, I tell A33, mute your microphone. Okay, Evans. Evans, you have a question?
Yes,
Oh,
madam.
yes.
Okay, madam, please.
So what
A
I
person
was
to add on to what Elijah.
Hold on. Jeff, hold on, please. Madam, please continue.
it is not an inflammatory reaction. The
Okay,
headache
madam.
effect of the medication is not as a result of an inflammatory reaction.
So in such case, when it becomes severe, is it necessary for you to take a painkiller to manage that pain, that headache?
Yeah, but if it's severe, why would you want to endure it? Yes, you definitely need to take a painkiller to manage it. But you see, what I'm trying to tell you is that the fact that there is pain doesn't mean that it is due to an inflammatory reaction.
Okay.
Mm-hmm.
Okay.
For you to say that there's an inflammatory reaction, you have to have all the 5 classical signs of inflammation: the pain, the redness, the heat, the swelling, and then the loss of function. So all these 5 things have to be present for you to say that inflammation has occurred.
Okay, madam.
Okay.
Right.
Jeff, you had a question.
Okay, madam, please. A question to add on to what Elisha asked.
Yes, Jeff, go on.
Madam, please, can I?
Jeff, go on.
Okay. What about a patient or some?
Jeff, we are losing you.
Someone is penicillin and has anaphylaxis.
Can I also use microphone? Or use mic angaza?
Jeff, can you position yourself or we can hardly hear you? Hello, Jeff.
Okay, coronavirus actually might.
Evans, you had a question. Go on until probably Jeff can
Yeah,
continue.
my question is,
Madam, can I continue? Yeah.
What's your question? You're afraid of dogs.
Can I continue?
Jeff, your line is breaking. Can you position yourself so we can hear you well?
Okay, can you hear me now?
Yes. It's okay. Go ahead.
Okay, I was asking that what about someone who is hypersensitive to penicillin, and a person comes into contact with penicillin, and then the person has an anaphylactic reaction, and what about that one? Is that one to some sort of inflammation or something? Because airway seems to be blocked.
The anaphylactic reaction is a hypersensitivity reaction, a type 1 hypersensitivity reaction. And so that will lead to formation of antigen-antibody complexes. And yes, that is inflammation.
All right. The reason I asked is that per what Elisha was asking whether the drug amoxicillin had an issue with the headache. And then we were saying, so I didn't understand the.
He said that you have a headache as a side effect, which is different from having anaphylaxis.
Okay. Sure.
So we have about 8 minutes for the 40 minutes to be up. Evans, you had a question.
Yeah, And when you go to my village, they will tell you that moja daho, whatever it is. So I bought this pain heat. So, madam, does it mean that the pain heat was melting the blood? Moja na daho na say it. I don't really understand. So and does it mean, so suppose I did not apply the gel, would the pain go by itself? And that moja na adano, where would it go to?
No, so what you are talking about, what you people believe in, and what actually happens is that when you have an inflammatory reaction, there will be swelling, there will be heat, and all that. If you don't do anything, it will resolve. Okay,
Hey,
because then
that that pain was unbearable.
yes, so if you don't do anything, it will resolve. But because it is so severe, you will take medication, and that is what helps to resolve it faster. When you have an injury, there's a hematoma formation. So which is different from what we are talking about. Hematoma formation occurs when small blood vessels would rupture, and then you have a collection of blood in the subcutaneous tissue. That will resolve with time.
Oh, okay.
Yeah.
Thank you.
Any other question? We have about 7 minutes more.
Any other questions?
Madam, I have a question. So, does it mean that when there's an inflammation, let's say you get a fractured joint or something, and there's swelling there, if you apply this heat to that will make the inflammation go down. Like during in our local settings, they tell you, say, rub so by the time you wake up in the morning, the pain is reddish. The inflamed area that looks a bit reddish has gone down. So with that one, does it mean that the rub has some antihistamine in it, or it dissolves through the skin into the tissues, or what? How does it work?
It doesn't contain anything. It doesn't contain any antihistamine. So it's most likely just placebo. If you have an injury, like a musculoskeletal injury, that is different from if you fall down and you put rub on it. And actually,
So that it contains menthol. It just to suit the pain from there.
pardon?
And then it contains menthol, that rub now.
But that is
It's
not
just for suiting.
that doesn't take away the heat and the swelling. All those things will resolve by themselves. So the menthol is just a topical agent. It doesn't do anything to the inflammatory process.
Maybe it suits the pain, and then they are a little bit relieved.
Madam, hello, madam. Yes, these herbalists, the herbal people, they talk of drugs that they apply on the skin, and it penetrates the skin into systemic and initiate a systemic effect. I mean, I want to know, how true is that?
How will I know what exactly? I mean, so medications, route of action of medications, can have topical. So topical can go through the skin and be absorbed. You can have IV. As to how the medication acts, I couldn't be able to say. I wouldn't be able to tell because I don't know the mechanism of action of the herbs.
Okay, madam.
All right.
So we have about 4 minutes more to go. Any other question?
Okay. All right.
Yeah, thinking of it.
Well, you have 4 minutes to do so.
O'Neill, start.
Okay, thank you very much, madam, for your time this evening.
Okay.
Right.
Madam, have a good evening. Night.
Why? Are you
Tomorrow,
starting
7 p.m.
What time for tomorrow?
7 p.m.
Okay.
The weekend, please. The weekend class
So,
still holds, right?
are we going to have both pathology and clinical methods tomorrow?
We'll be alternating.
Yes.
We'll be
Nick.
alternating.
Now, when you know who's on, I mean, yeah.
Oh, yeah, you can't do. Oh,
Evans,
Madam, the
John
next
Boy.
topic. Please, may you know the next topic?
Elijah, me mouse.
Thank you for your time.
Right.
All right.
Right.
Bye-bye.
Bye.
No feel the line, so.